The easiest way to explain what an exercise physiologist is that we design and implement exercise interventions for people who have acute conditions, injuries, diseases, or chronic pain. And we implement these exercise programs and use it as a form of medication until the person can either resolve their problem or manage their condition as best as they can to a point where they can get on with their lives. The funny thing about the body is that it can heal itself if you expose it to the right environments and the right stimulus. And what we are taught and what we believe is that exercise is the invisible pill to health. So to become an exercise physiologist, we need to study an undergraduate degree. So I studied a Bachelor of Exercise Science and Human Movement, which was 3 years. And then from there, you need to study a postgraduate degree. So I did a Master's in Clinical Exercise and Rehabilitation, and that qualified me as an accredited exercise physiologist. And in that Master's course, you need to acquire 500 hours of practical work. So accumulating hours working with clients who have musculoskeletal conditions, cardiometabolic conditions, just obviously in order to get that experience before you go out into the working force. Some of the common misconceptions are no, an exercise physiologist is not a personal trainer. Two different scopes of practice. A personal trainer is qualified to train healthy populations, so that's generally health and fitness, and an exercise physiologist use exercise interventions for people in the high risk category, so people who have injuries, illnesses, conditions and diseases. So healthy is personal trainers, non-healthy or high risk populations are exercise physiologists. No, an exercise physiologist and a physio are two different scopes of practice. They do fall under the same umbrella of allied health practitioners, similar to like physio, podiatrists, chiropractors. Exercise physiologists are also in that same umbrella, but physiotherapists are qualified to undertake manual therapy, so massage and manipulation, and generally work in the acute phase of injuries, whereas an exercise physiologist purely undertakes the exercise side of rehab, and not just for musculoskeletal injuries, but also psychological conditions, diseases, illnesses and chronic pain. No, an exercise physiologist does not undertake any massage. It's a hands-off scope of practice. Exercise physiologists don't just prescribe gym programs. Doing an exercise in a gym is one form of an intervention, but in some scenarios a gym may not be necessary or does not suit the individual. So we can design programs that can be done at home, can be done in a pool, can be done outdoors. It has to be designed in a way that suits the person and can be adhered to by the person as well, which is the most important thing. Exercise physiologists don't just work with people in the high risk category, so people who have injuries, diseases, conditions. We also work with healthy populations, so rehabilitation is one side of our scope, but also working with people who need strength and conditioning or improving their performance or just improving their lifestyle or general health and fitness. That's also something that we're equipped to do. Some frequently asked questions are, so out of your first session, which is generally the most thorough session and the longest session, it's normally an hour plus, that's where it's pretty much a sit down and getting to know the individual on a deeper level. So there's a lot of history taking about their lifestyle, not just for the reason why they came and saw me, but I get to learn about them previously. So growing up, if they had an active lifestyle or if they had any injuries or any other health issues that happened at an earlier stage of their life, because it can affect their current status. And once that's done, then we develop a plan together. The general rule of thumb for how often a client needs to see me may range from a few times a week to once a fortnight or once a month. It's totally dependent on the person as an individual and their status. Yes, patients are entitled to rebates, and this can be done in 3 ways. It can be done through Medicare, so getting a care plan endorsed by their treater or their doctor in most cases. Your private health insurance, generally you're entitled to rebates up to 85% with that as well. And also for DVA card holders, so discharged veterans, they're also entitled to health rebates. Seeing an exercise physiologist doesn't have to be ongoing for a long period of time. Our end goal from day one is always for the individual to manage their health and exercise on their own. So it's just our job to educate them as a person about their injury or their goal, whatever it may be, and get them to manage it on their own. So we have a large role in the initial stages of working with the client, and then we taper off until a point where they can manage their exercise on their own.